One of the most significant types of medical malpractice cases that we work on here at Lupitan and Unitan are matters that involve injuries to babies and newborns, otherwise called birth injury cases. And these types of medical malpractice matters fall into two categories. Typically, there is an error in the lead up to birth, or there's an error in the treatment of the baby after birth. With respect to birth injury cases that involve injuries that developed or happened before the baby was born, they can fall into a couple different categories as well. One can be overall monitoring of mom during the course of her pregnancy. Sometimes mom has a condition like preeclampsia, or there's an indication of another condition called intrauterine growth restriction, and of course other conditions as well. Sometimes gestational diabetes can have some significant complications. And if the mother's obstetrician is not as careful and attentive as he or she should be in responding to mom's serious medical conditions, it can lead to very serious injuries of the baby and sometimes mom. Another category that we often handle of birth injury cases are matters that develop right before birth in the labor and delivery phase. Now, when moms go into hospitals to deliver their babies, they are inevitably placed on what's called a fetal heart monitor. And so two monitors are actually put on mom. One is measuring her contractions, and the other one is measuring the baby's heart rate. Mom is typically attached to a pulse oximeter that shows her heart rate in relation to the baby's. Now, labor and delivery nurses and obstetricians in hospitals know of the significant importance of closely monitoring and timely responding to changes of significance in the fetal heart monitor. So if the baby's heart changes from healthy to unhealthy, the doctors and nurses need to quickly respond and either change what's going on under the circumstances or carry out an emergency C-section. If they don't, and the baby is in a dangerously low oxygen environment for too long, is called hypoxic ischemic encephalopathy, or HIE. If your baby was born and was ultimately diagnosed with a brain injury related to hypoxic ischemic encephalopathy, which means that the baby did not get enough oxygen, which led to not enough blood flow to the brain, and you had an otherwise normal pregnancy, you should consider contacting a medical malpractice lawyer like the lawyers at Lupitan and Unitan to evaluate whether medical malpractice contributed to your child's injury. Another type of birth injury lawsuit that we frequently work on are cases involving a substandard resuscitation of a baby. Sometimes when babies are born, they come out what's called depressed. They're not breathing as well as they should be. They're having a difficult time transitioning into life. Sometimes babies are born in the presence of what's called meconium, which is essentially a bowel movement made by the baby in utero that can sometimes get into the baby's lungs and impact their ability to breathe. Now, there are very specific guidelines that doctors and nurses must follow when a baby is born depressed. If the baby has a heart rate below a certain level, if the baby is having certain factors or presentation signs and symptoms, the care team has to follow very specific steps. Oftentimes, the steps are shown right on an algorithm on a wall near where the baby's resuscitated. And if the medical care providers fail to properly follow the algorithm, fail to properly follow the safety steps necessary to ensure a proper resuscitation of the baby can suffer a lack of oxygen. And if that goes on for too long, the baby is going to suffer an injury to the brain and other organs of the body. If your baby developed a significant brain injury or injury to other organs of the body, sometimes the kidneys, the lungs can be injured due to a lack of oxygen, and everything seemed to be going fine until the resuscitation period, you should contact a lawyer that specializes in medical malpractice and birth injury cases like those at Lupitan and Unitan to investigate whether medical malpractice in the course of attempting to resuscitate the baby may have contributed to your child's injury.